Hi and welcome. I'm very excited today with Europe's future aesthetic trends to share with you the actual inventor. And she's on the line. It's late in Italy right now, but she's there wanting to share with you all the new techniques that are gaining momentum. And actually, she invented them during COVID, which is really interesting. So I guess she had a little bit of free time, even though I know that Italy was hit pretty bad. There is a growing demand among patients. And these procedures that we're going to talk about today are very, very popular, and patients are asking for them. They want treatments to last longer. They want more than one layer. So we're going to talk today about some dual layer. Europe itself is not doing this, but it's being done in Rome, Italy right now, with all FDA approved technologies, handheld devices, injectables and fillers, and it's the combining of them. And there is a growing demand. So you have to listen very carefully today. Dr. Annalisa will actually be putting together a training program, and I will tell you more about her, but all FDA approved anti-aging rejuvenation techniques. So welcome to our webinar. We have a complete, amazing schedule with key opinion leaders. You can visit at beautifulforever.com. At the end of this, I also will have the next few speakers I'm very proud to have interview coming up. And we have a mentoring program that's really been growing by leaps and bounds. So if you know somebody, or you have a startup, or you know somebody struggling, whether they're starting up or they're expanding and they need help, we're willing to help them and work with them because we want everybody to be successful. So consulting is what I've been doing for over 35 years, and I'm happy to help startups or expansions to grow. So there's our guest, and she is live, and you'll meet her in a minute. Dr. Annalisa Calisti, she is in Rome, Italy, and she is a coordinator for the Italian Society of Aesthetic Medicine and other societies as well. She's been doing the face and the neck and the body, injectables, fillers, for at least 10 years. She's an expert and likes to combine treatments and combine injectables and fillers with handheld devices in combination that are very unique. And we're not doing them here in the US yet. We have to get Annalisa over here so she could start training some of the top experts here. But she's the expert in the field, and interesting that she had so much time during COVID to invent these new methods of rejuvenation. She will tell you about them today. She's a regional coordinator of the Italian Society for Aesthetic Medicine. I've been part of that, and it's a wonderful society. Even if you're not in Italy, you can join it from the US. They have an English version, so you'll probably see me there as well. And she's a member of the different aesthetic societies since 2017. And she runs different academies. She's on the board and the committee of the International Association for Stem Cells and Regenerative Medicine. So she's really on the top of her game. She has a couple of locations in Rome. And I'm very excited to have her with us here tonight. So Annalisa, welcome.
Hi. How are you? I'm so glad to be with you tonight. It's always a pleasure. You are a genius, Cheryl. Really, I'm so happy.
Well, I'm very happy to have you here too. And I wish that Rome, Italy was a little closer because I will be coming out to visit. But we might have to get you here to do some training too.
Yeah, I will with great pleasure. I love teaching so much.
That is great. And I know that you have so many pearls to share. So we're going to go over 3 new COVID created trends that you have created. And I know you're presenting at some European and Egyptian conferences coming up. And the first one is the 360-degree eyes. And, you know, from what you and I discussed during COVID, when you created this, it was because people were wearing the masks, and you came up with this idea. So I'd like you to talk a little bit about your 360-degree eyes, which I think is a genius idea.
Thank you for these very, very kind words. But incredibly, in this COVID time, so rough, really, uh, there was an increasing of demanding for aesthetic treatments, both for eyes, both for skin. And for the eyes, for example, there is a big request for, because people is seen only from the nose and up the forehead. So an increasing number of questions about what kind of treatment can I do for my forehead, for my eyes, and so on. So they were focused on their eyes. Also with the webinar, also school teachers always do webinar with students, or also people, engineers, and everybody is talking on a webinar. So when they are with other people, they wear the mask, but and also when they see themselves on the screen, and they see that the eyes are very, very important. So what can you do when you show, especially the eyes? There are many things to do. The first thing that you should have a relaxed look. A relaxed look doesn't mean to have evil eyes or Mephistopheles look, but you can have a relaxed look with botulinum toxin, and sometimes in little older woman, or better, less younger woman, they can see like a hollowness in the side of the eyebrows, and also in the lower eyelid. Uh, and together with it, they have some many mistakes with eyebrows, aesthetic treatments in the ears, with pigmentation, tattoos, and so I put together all these aspects, all these of the beauty of the eyes, and and I developed with my expert of the dermopigmentation, that is, she is from Brazil, Natalia de Souza. I developed a method to create wonderful eyes, very relaxed and at the same time sexy and fresh. So I use many techniques together. Before, the first step is always botulinum toxin, because it is essential to see what the first treatment with botulinum toxin does. So I wait 1 week, then I add some fillers in the eyebrows zone and in forehead zone. Then I act with Dermapen for a microneedling with some very special products. A small secret of mine. And then she acts finally on the final result from aesthetic medicine with esthetician and the pigmenter action, with a wonderful calculation of the position and the design of eyebrows with special techniques, following the famous sequence, numeric sequence of Fibonacci. That is based on the perfect equilibrium, on the aurea, the aurea proporzione, so the perfect proportion that is in the most famous paintings and drawings of artists from all around the world. But if we come to Italy, we remember Leonardo da Vinci, Michelangelo Buonarroti, Raffaello Sanzio. All these artistic features has the common denominator of the aurea proporzione, cioè the perfect proportion, because beauty is done of perfect proportion, not of only increasing or volumes, or doing extreme Botox, proportion and harmony are the best, the best goal you can achieve. And this is my goal always.
So how did you wind up pulling together all of these different layers for the eyes we're focused on now? How did you wind up experimenting and figuring out that this was the perfect 360 degrees for the eyes?
Oh, because after many years of practice, I know what to do, and I think it's very important to have an artistic point of view with patients, not only do treatments mechanically. You have to have an artistic vision. So naturally, the treatments are customized depending on the age of the patient. But I understood that correction of symmetry, of asymmetry, and increasing the open the eyes with Botox, for example, sometimes is not enough, because some women, not only less a young woman, also young women have an hollowness in the position of the eyebrows. So this way, the combined treatments is wonderful, but I understand that they need some more. More, it means some shine, because we women have to shine. So I understood that I had to take care, not also, but it's very important, take care of the skin around the eyes. So correct the darkness when it's the hyperpigmentation, and also fine lines, and also an aspect of the skin that can be a little wrinkly and with creases. This way I understood that I had to combine these treatments. And some patients, I have many actresses, Italian actresses and singers like fashion, they know they are never happy of the result. So I always try to do the best, but at the same time, not to do too much. That is not the same. They are not synonymous. Too much doesn't mean the best. Sometimes we have to modulate techniques together to reach the best result in the based on the symmetry, on the harmony, on art. And so I had these good results. And also, this is something of mine personally. I have never done something to my eyebrows. I met the wonderful dermopigmenter I told you about from Brazil, and I understood that is a perfect complement to the treatment. So now my patients, not only they have good, beautiful lips, beautiful cheeks, but they have always perfect eyes at any age.
And I agree with that. I mean, the eyes have it all, and the eyebrows are the frame to the face, as we talked about. And the fact that all of the photos that I've seen, you know, that you post and that you have on Instagram and that you have out there, and some we have today, are all very natural, which I think is great, because too many people are overdoing.
Yeah.
Because as you said, like maybe it's the actresses and people who want to look like a celebrity, but they're overdone. And it's not attractive to be so overdone. There's a point where you need to stop and like the way and feel beautiful about yourself. And there's some people that just want to keep coming in for more and more. How do you handle that when they want to come in for more and you think, okay, you look perfect now, it's symmetry, it's perfect, you look great, and they say, no, but I want more?
Yeah, for sure. A couple of years, 2 years ago or 3 years ago, I presented I think, an interesting presentation about the overfilled syndrome. This is a real syndrome because hyaluronic acid, especially the highly cross-linked hyaluronic acid that you use to correct, for example, the chin of the cheekbones, uh, it doesn't reabsorb in 1 year. You can find also after 2 years. This is not an opinion of mine because I study naturally for my job, for my work. So there are many articles showing that you can find hyaluronic acid, especially cross-linking, especially when you make the position very superficially after years, the first treatment. There is a case report very interesting about an operation they have done to the lips, and they found the hyaluronic acid treatment that was positioned for treatment 2 years ago. So if you do every 3-4 months the same kind of treatment, this is bad. The aesthetic doctor should perform the treatment according to the duration of the filler and do other treatments. For example, Botox, you have to repeat, or for example, the dual layer we will talk about later. You can repeat, but not always overfill the face because the result is deformation. Is not more. Many actresses also in USA, in Italy also, they have a face that is no more harmonic. They can move. With fibrotic tissue, they can move naturally, and because there's too much. So never ask too much. I repeat myself, too much is not the best. Too much, you can do a small touch up and the patient will be wonderful. So you have seen my patient on, they all are natural and they are beautiful, they're happy. I have patients that start with me not 10, but 15 years ago. And they look younger than 15 years ago because they're constant. They do something that in USA is not allowed. It is necessary, so I will not talk about it, but some small fillers, changing the cross-linking. So it's something that you learn not only, you can't learn in 1 week, of course, for sure, but if you have a good teacher that teaches you what is better to do in the follow-up, it is very easy to show an immediate result. For example, you remember my article about Instagram lip deception, no? For example, everybody on web is showing lips immediately done. This is not the real result, for sure. And so I teach all these small secrets. So don't look also to the patients, because patients should be taught also, no? So they have to understand what what you are doing to them. So I agree with you 100%. It is important to modulate and to interpret aesthetic medicine, not like a one-time treatment, like a therapy that you have to follow all your life long. Otherwise, you come to me full of miracles and you need miracles. No, I will send you to the plastic surgeon.
Yeah, I'm wondering at what point you send them to a plastic surgeon, since you don't do surgery and you're the expert in the injectables and the fillers. At what point do you send somebody to a plastic surgeon? And then the next thing is, even if you send them for plastic surgery, they still have to come back to you for the Botox and the fillers afterwards.
Yeah, Anyway, aesthetic medicine is a wonderful complement for aesthetic surgery, aesthetic doctor, aesthetic surgeon, and aesthetician can work together in a wonderful group of people working together for the patient at in the best way. And sometimes aesthetic doctor can solve problems through aesthetic surgeon. I've done today with for example, with a friend of mine is a plastic surgeon. He's a very nice guy. He made a filler for the nose 8 months ago, and the patient showed in these days swelling in the part. But so how is possible? It's possible with vaccine. We should vaccine ourselves. I have the vaccine for sure, but sometimes you can have some swelling after the vaccination for this terrible illness. So we can work together without problems. And also,
so there was one thing you just said. So after the vaccine and the swelling from the hyaluronic acid in fillers, how long can I mean, most people say it happens immediately, but I know when we spoke, you said it's a longer period of time. What's the length of time after the injections and after the vaccines that you can still see the swelling?
For example, this we have to naturally we have to understand if the problem came after the vaccine, but after 8 months, it can be or a late onset low-grade infection of the filler or reaction to the vaccine. In USA, I read many articles. I know that they talked about 4 cases. Is really few. Also in Italy, this is just because I see many patients. I have many friends that ask me for help when something happened. Being me expert also in a complication of fillers. So till now I've seen only one, this patient, and then I know. But this is very rare. So you can do filler safely, but empirically it has been suggested to do filler or 15 years before or 15 years after the vaccine, just to be sure. And naturally, the patient knows when he has some allergic problems genetically, no?
So that was 15 days?
Yeah, that's
okay, because I didn't, it wasn't clear. Okay, so it's 15 days to wait before or after a vaccine to actually get the filler.
Yeah.
And that makes sense. So on the next slide, we're talking about the trends in skin. So when a patient comes in and you have all these amazing new dual layer techniques that we'll talk about today, you have to do a consult because, you know, most people come in and they say, oh, I need Botox, I need filler. They don't know what they need. You have to tell them. Now, not only are you telling them you need Botox and filler, you're explaining in more detail, and you're very detail oriented, which makes you so special and so great at what you do. And you care so much about each patient. You're spending a lot of time with each patient. You have to now explain not only the Botox or the filler, but the dual technique of what you're doing. So you charge, as we had discussed, for a consult, and you spend about what, 20 minutes or so. So tell us a little bit about how, you know, brief overview of how a consult is for you to explain any of these new trends and techniques.
Yeah, when I meet patient, the consult is fundamental because it's we aesthetic doctors, we have to remember that we are doctors. So we are going to plan a therapy with the patient. So it's not aesthetic medicine on demand. Perhaps I will lose money doing like that. but it's not on demand. So the patient has a question and has a need, okay, but we have to talk together. So I explain what is better for them, and for sure the consult is very, very important. First, because I have to do thoroughly a medical history from I have to ask for the medical clinical history of the patient, because I'm a doctor. I'm doing something that is a medical act, or Botox or filler, or my technique is always so. This is very important. Is not on the. We are not talking. We are not going to do something that you. Oh, I want this. Okay, no, no, no. We talk together and we decide together always. So sometimes because also always because also because sometimes we see together with 4 eyes something more than with 2 eyes, and naturally a doctor has perhaps not 2 eyes but more, no, because it's experience. So for example, these are many in this slide. There are many patients. Every one of them has a specific demand, a specific question. The first, he is a writer. He wanted to be very fresh, fresh look for the vernissage of. Because he does paintings and he writes books, so I want to be fresh. He's young, as you can see. The second patient just wanted to do some filler. The third patient came for Botox. The fourth patient came for filler. The last patient is a singer, is quite a famous Italian singer. And she had to do a video in Brazil, and the producer of the video said, "You should be the same, but younger." And she, as you can see, she's the same. So she came to me with some requests. I said, no, okay, you should do this, and take care of the skin. Also, cosmetic products are very important, and it is a part of the first concept.
No, the photos, the before and afters are great. I noticed the one on the bottom left, the woman who has the oblong face. She really, her skin texture and tone totally changed. The lighting is a little bit different, but you can see the difference in her face. I mean, you really did an amazing job on all of them.
Yeah, she came, there are 2 different colors, but it was a distance of month, because she came back from holiday, so she was done with the first picture, but she came for the same day. Oh, the patients, they're very nice. They will ask for the same things: cheekbones, nasojugal folds, nasolabial folds, lips, Botox. Okay, so we do everything, but you have to take care of your skin. First, drink more water. Second, take some supplements of collagen. Third, I will do you my double layer skin booster. And I act on her with this technique. This is completely new. This is my invention. I'm very proud of this, because I don't do many good things, but sometimes I can find solutions. So she had a double skin booster with a double approach in 2 different layers, under the dermis and over and above on the epidermis. And this is the result. This is only after the first application. of the treatment, the first treatment, after 1 month. In fact, she's not on anymore. And the thing of this treatment is, the important thing is absolutely not painful at all. Is this is very important for patients. And the second, that the result is immediate. So the patient come out from my office ready to go for a dinner or for a meeting. I don't know what she wants, or meet the fiance or the boyfriend or go to disco, but with a wonderful face. And I can assure you that I worked so much on that face with microcannulas and needles, but she went out like that. And as you can see, she has a very beautiful skin. But see the second picture. The second picture, I am not a dermatologist, as you know. I have a specialization in aesthetic medicine and vascular surgery. And I know this patient, I don't know, 20 years. She is a patient of mine for veins, before for cellulitis and so on. And now after menopause, she developed rosacea. And I performed to her the dual layer skin booster. This is what happened. Rosacea is a very, very important illness. So I don't want to be presumptuous and say that is the solution, because it's something that you have to take care for your life. Anyway, she made many treatments with energy based devices, but with low results. She came to me and, okay, we do the dual layer. You need some freshness, and see the redness has gone. The third patient, he has dermatitis, seborrheic dermatitis. And I repeat, I am not so presumptuous to say that it's a solution, but he was so happy. This is after 1 month, the second picture. He has done also Botox and the dual layer skin booster. And this is the lotion. Dermatitis, seborrheic dermatitis is still there a little bit, but the appearance is very good and he's so happy. So this is the importance of aesthetic medicine. That is medicine. Sometimes you develop some protocols that are important not only to look better. Tonight I had one of the best makeup artists in Italy to have this interview with you, because I'm proud. But this is makeup, but this is not makeup. They are without makeup. All my patients in the pictures. So it's important to develop protocols that are a mix of a wonderful look, immediately for look, but they last long. They have also a medical effect. And this is the secret of the technique. The secret is not naturally, it's always the same, no? Injection, microneedling, peelings, it's always the same. But the secret is in use good products and know how to mix them when it is possible.
And you do a great job, I think. And that's probably, I mean, not only do the pictures, but listening to you, we know why you're booked out 3, 4, 5, 6 months, because everybody wants you and they want your talent. I think it's also good that you have referral networks, whether it's with your tattoo artist who does the eyebrows, or the person who does the eyelashes, or the person that did your makeup. And I think a lot of people have to learn in this industry that they either need to have them in-house or somebody that can refer back and forth to each other, or come in, we call it independent contractor, 1099, and work as needed or be on the staff, depending. But if somebody's an esthetician, it's a great combination with a cosmetic injector like yourself to have the esthetician there to be able to perform other treatments that you don't have to waste your time on, but you can guide them on what to do and train them, as well as home use maintenance products. Like you said, people have to take care of their skin, which is most important, and not let it go for 5 years and 10 years and then come to you and say, do miracles. We need people to keep up every year, multiple times. And I like the fact that you put together like a blueprint and you talk to them about what they need, and they trust you. So they come back in and they probably don't even ask you how much something costs, because they're just happy to be sitting in the chair and you working on them.
Yeah, and this I learned also from you, from first presentation I heard for you many years ago, and for sure it was in my brain and it was elaborated in my brain. So I'm a little slow perhaps sometimes, but I understood, and the cooperation with other other people in aesthetic field is fundamental. It's not it's not a war. On the contrary, it is a connection, and a wonderful connection, not to add results, but to multiplicate the results. And thank you, Cheryl.
You are very welcome. And you take photos of everybody before and after, at the moment that they come in, or they have to come back a month later or a week later, and then you take the after pictures?
I do pictures of before, then after the treatment. Sometimes I do also pictures immediately after for dual layer, because the result is incredible immediately and it lasts for months. And but when I perform other kind of treatment like Botox, I make a picture after 10 days, and usually patients come back after 20 days. And I do, for example, Botox is 10 days, 10, 12 days, because the result is more or less stabilized. For filler, I like to make pictures like in follow-up of vascular surgery, immediately 1 week, 1 month, 3 months. And they come, they are happy, because this way, this is a real treatment. This is a real medical, aesthetic medical care of patients. Just follow up, follow up, follow up, and decide together, oh, if they look less fresh, you can do something little to enhance the result of the first treatment. So but always pictures before and after. But for example, I don't want to repeat too much, but for example, you have you perform a treatment for lips enhancement or lips correction. The immediately after picture has no sense, because it's swelling. This is another article that I published. Thank you also. That because you have the needle, there's a trauma. If you go with the head against the door the day after, and immediately you have a bump, you know. Yeah. It's the same thing to the lips. You inject with a needle in the lips. This is a trauma. Also with a cannula, and also the anesthetic cream, for example, it enhances the volume of the lips immediately. And furthermore, the hyaluronic acid in the beginning it causes water lymph from your body, so you are swelling immediately after. So what's the sense to do the picture immediately after? No sense. Only advertising. Okay. The real result is 10 days, 10, 12 days after. So this is the time between the delta time, the delta T I use between before and after. Because I want to show real results, not, I don't need to, to call people like, I don't need to fish, you understand? I don't like, it's not my style. I want they look at my results. If they like, I'm here for them.
But it's interesting because I find that most of the practices and med spas and providers that we talk to, they have a hard time getting people to come back in for the after pictures. Maybe they'll come back in the 10 or 20 days later to see if they need a little bit more Botox or a little bit more filler. But it's hard for them to get patients in. So maybe one of the tricks you can tell us, when they come back in for the photos, are you also doing other additional treatments on them at the same time that encourages them to come in for the photos?
For example, for Botox injections, I always, it's mandatory, they have to come after 1 week, 8 days, 10 days, because especially when this is the first time, but always anyway, because the second time I can, if there are small asymmetries, I can correct, or if we decide to have more enhancement of the open look, I add some Botox. And if some Botox is still in the vial, there has been in a sterile way and served in a refrigerator with the name of the patient, with the signature of the patient, because I use always the same product of the patient. This is not so bad, because many people use the Botox for everyone. No, I use for every person, or every patient, the same vial. This is very important. So, I use some Botox for some special techniques after the Botox. Sometimes it's a little gift if I am very happy. Sometimes I perform a new treatment using that Botox.
So that's interesting. So everybody is buying a vial of Botox. It's not like they're buying 8 units, 20 units, an area. They buy the whole vial and then you save it. How long does that stay good for when you put it in the refrigerator? And you obviously are doing a good job of security and having them sign and know it's for them. How long is that good for?
It has been stabilized that Botox, the action of Botox lasts so long time, especially with the new formulations that don't need the refrigerator. Anyway, I don't serve the vial for more than 7, 8, 10 days, and always for the same patient. Not because of lack of action of the toxin, but for bacteria problems, because I don't want to develop some bacteria, because the vial is with saline or buffer solution. So even if we do everything in a sterile manner, but I don't use, you know that I am a PhD also in infections of devices, so I don't like, I know how important it is to avoid infections, also low grade. Low grade are infections that develop in months, also after 2 years from the infection. So I'm very careful, and thanks God you found problems.
Well, because you are so careful. So on the next slide, we're going to talk about the sexy lips. And I know this is your favorite, so I'll let you talk about your shield lips, which is another invention of yours.
May I say the names of these persons?
Yes, absolutely.
The first is the wonderful Viola Davis. She is the top actress of How Get Away with Murder, one of my favorite series, Netflix, COVID time and series. And the second is the wonderful Madonna. I love her. As you can see, they have shield lips, two in a different manner. The first one has like a line in the middle of the superior of the upper lip. And the second one has like a vertex, a triangle lip in the lower lip. I'm tired of dull lips. I'm so tired to see patients with square face with a heart shape of lip. This is ridiculous. This is not artistic. So for every woman, it's important to choose the right shape of lips. So I'm going against, I'm tired of cherry and heart and no, shield lips. We are strong. We women are strong. The shield is also a symbol not only of defense, but also to attack. If you think about the Romanian warriors, also the Latin warriors, and not only. So the shield lips is an enhancement, almost natural, of the natural shape of some lips, and is absolutely sexy because it enhances the lower lip. That is the most sexy part of the lips. Many patients ask for, oh, I need an enhancement of upper lip. Also, what do you want to do? You want to have a big upper lip and a subtle lower lip? No, this is the good proportion. Viola Davis has the nature with her, so she's amazing. Madonna also, she's amazing, but perhaps she has some aid to of aesthetic meds, perhaps, I don't know. But see the shape of the lips. It is an art, but is at the same time a shield. What is the best shape for a strong woman like that? And so this is a new shape that I'm applying to my patients. So happy, especially for not so young patients, because they are very sexy this way, a strong look, sexy, but at the same time, and they are not ridiculous. So naturally, this is, you have to adapt the shape to the different kind of face. But I think this is the new trend for sure. The shield lip, and as usual, Madonna is our teacher. But
It's amazing. No, it's amazing. And she's well into her 60s. So, I mean, she looks.
I'm not, I don't, in Italian we say obiettiva. I don't know if it's the same in English, objective. So I am influenced by, because I love her so much. But this is a wonderful shape. See the tip of the lower lip. This is the shape of the woman of the 20th, of the 21st century.
And it's interesting because until you sent the picture and you really brought it to my attention, I really didn't realize that it was that heart shape, which is amazing. And it looks beautiful. I mean, she couldn't look bad, to be honest, but it's very beautiful on her. And she has a lot of fans like you all over the world. And that's what makes her so famous. And Viola lips are very appropriate for her face and has symmetry, as you talked about before. So the alternative heart lips is not for everybody, as we talked about, because it's a personal shape depending on your face. So we're going to go on to the next slide. And there's so many good takeaways from today. So many possible questions that people can have, and they could email us, and I will, of course, pass them on to you. We have a handout every time that we do, because I write articles, as you now do, write articles, and you speak a lot, and I'm very proud of you for all of that. So the decision-making process and getting a patient to say yes is our webinar handout today. So if you're on the webinar, you will get it automatically sent to you. And it's one of the articles that we have published, and we have weekly and monthly articles published, proud to say. So that is one that everybody will get. This will be available after today. It will be on our YouTube channel and the Beautiful Forever. But any questions you have or ideas you have, we're always interested. And is there a key or one, even though you have so many wonderful things, but is there a key idea or a takeaway that you want to leave with any of the providers that might be listening today?
Yes, for sure. The key is that don't go to aesthetic doctor for treatment on the mind. You have to approach with thinking that he is a doctor, and you would be safe, and you will have the best result. And also always ask to see what kind of product you will be injected in with, and for always take care of your skin, especially now that we have to wear this mask for the most of time. No, this is a problem sometimes for dry skin, but also for not so dry skin. So always use cosmetics for hydrating and calming the skin. And I thank you very much. This is, I hope that everybody is interested to my dual layer skin booster. I'm very proud of this. As do you remember, before the threads, I was so proud of my technique for the neck, for the 3D vision circumferential neck rejuvenation, non-surgical. And now this is the time of the dual layer skin booster for Calisti, Annalisa Calisti method. This is mine. But I'm very generous, so I am ready to share my with you.
And I'm very excited. Maybe we could set up some trainings for you to come to the US and visit, or I'll get a group and we'll come to Rome. As soon as everybody felt safe enough to travel, it would be wonderful. And it's just wonderful spending time with you, even on Zoom, and seeing you, and you look as beautiful as ever. And I look forward to having you on again and seeing what else you're going to invent after tonight.
Yeah, so I have some new ideas for this is another thing for the dark circles, but we are just developing a new combined technique, because the future are combined techniques for sure.
Well, thank you very much, and I'll let you go off to your late dinner, because I know for you it's 7 hours later. And I wish you a good evening, and thank you for all of your great information. It's a lot to absorb, and we will be promoting it for others that couldn't make it tonight. But thank you very much again.
Thank you. It was so pleasure, and I say ciao from Rome to everybody. I'll wait for you as soon as possible.
Thank you, and ciao to you as well. Have a good evening.
Thank you.
So what's new? Well, it's important that you need to update your menu, and you have to constantly update, especially now after we had a lull of a year and everybody is very busy. You should remember adding new profit centers to your menu, adding new bottom line income, maybe training your staff, having the staff assessed. We've been doing a lot of mystery shopping calls and mystery shopping visits lately. Updating the menu of services, as well as training the staff. We have a complimentary session to expand your profit centers or to help you with your business. And we do have a special today, a discount code PROFIT. It's a limited quantity, the first 10 people, for $19.99, which is a great deal. The book itself is available on beautifulforever.com or on Amazon. Beautifully Profitable is a great book to be able to hold a meeting in your practice. And it's a great book for everybody in the practice to read a section and be able to talk about. And my suggestion to be successful is get everybody in the practice involved in even a 15-minute marketing meeting every month. And you will see internally how things will grow. And I want to talk to you about our next very exciting group of topics that we'll be doing expert interviews of key opinion leaders. Very proud to say that longtime amazing young friend, Dr. David Goldberg, board certified dermatologist, is very well known internationally, actually in Italy, I believe. No, maybe it's in Paris. He has a meeting every January. And I haven't been invited in the past to speak. So May 17th, mark your calendars down. We will be talking on hot topics in dermatology here in the US. And we have on May 12th, we have a very highly rated #1 practice manager for Dr. Adam Rubenstein. And Lee Nelson is the manager and amazing, and has very effective automated methods that she wants to share to help fill your provider's schedules. And feminine rejuvenation is still a very hot topic and growing. So we have Dr. Troy Halpern, who has been a longtime friend and colleague, a cosmetic gynecologist in San Antonio, Texas, to talk about her tips and tricks and what's going on in San Antonio and what's going on in the world of feminine rejuvenation. So stay tuned. Join us at beautifulforever.com. The Beautiful Forever University is expanding every day. We're very proud of that. Become part of our university, part of our educational programs and mentorship programs as well. And we'll see you soon.